Thanks for having me. My name is David Crocker, and I am a physician. I have been involved in the medical cannabis industry for about a decade. My original practice was as an interventional radiologist, which is someone that uses imaging to guide instruments and things around the body for various reasons. Unless you've been very sick, you probably don't know what an interventionalist is, but we do a lot of palliative care, end-of-life care, pain management, and things like that. The reason that I'm talking about this today, in our clinic, as CBD became more popular, patients were having difficulty finding good CBD products in the dispensaries, which were very focused on THC and so forth. So we thought it would be kind of a no-brainer to start our little CBD store called Premier Hemp. And our store is in the same building as our clinic in Kalamazoo. It's been very successful. Shortly after starting the store, we decided, hey, with my science background, I might as well make the products that we sell. And so we got a certified lab installed, and we've been making CBD products of various sorts for the last couple of years. I'm also a hemp farmer. This past season was the first season that we could grow hemp at a commercial scale for CBD in the state, and that's regulated by MDARD, the Michigan Department of Agriculture and Rural Development. But frankly, the things that I'll address today are based on the questions and misunderstandings that I have seen and heard. And basically today's talk is going to be kind of a who, what, when, where, why, and how for CBD. First off, what is CBD, right? Everyone here probably knows that CBD stands for cannabidiol. Cannabidiol is one of about 100 biologically active compounds in the cannabis plant. The CBD that we produce on our farm comes from the hemp plant. Okay, and there's hemp and then there's marijuana. It's the same genus and species, same plant, different varieties, just like there are different varieties of apples. The main difference is the legal distinction. Hemp has less than 0.3% THC by dry weight, whereas marijuana has more than 0.3% THC by dry weight, often a lot more, up to 30% sometimes. CBD is non-psychoactive. A lot of people consider it to be the kinder, gentler cousin to THC. It has a lot of good medical benefits without the psychoactive effects. When you hear about CBD, one of the first questions people will ask is it full spectrum or is it an isolate? Isolate products in the CBD world contain only CBD as an active ingredient, and then that is mixed. It's been purified. It looks like this is actual 99.9% pure CBD on that spoon right there out of our lab. And then we reformulate that with carrier oils and flavors and so forth. And then there's the full spectrum product, which has more of a tarry sort of appearance, and that contains not just the CBD, but a plethora of other compounds that you find in the cannabis plant. But what we're finding, and it's been borne out in my experience clinically, is that the full spectrum product, if you don't mind that little bit of THC in it, is preferable and more effective. The full spectrum products, again, have a large variety of different compounds in there, including the terpenes, which is what gives cannabis and a lot of other plants their flavors and smells. We know that THC works for a lot of things. We know that CBD works for a lot of things, and there's some overlap. And we also know that the two together work better than either one by themselves. Why are we talking about CBD now? We discovered CBD a long time ago. This is not a new discovery. I think a big part of why we're talking about it now is just the shift of public opinions. Cannabis in general, right, was allowed by prescription. It was on the U.S. formulary up until the early 1900s, around 1930. In the 1930s is when opiates started being used in the United States, and they, in effect, supplanted THC in cannabis as a pain-relieving medication. There's a lot of good reasons that cannabis has supplanted opiates largely. And it's not just that it's effective, but it's less dangerous. No one's ever died from a marijuana overdose. It's been used unregulated for decades. and no reported overdose fatalities, and there's no other medication on the market that can claim that. Another reason that CBD has become very popular, there's a little girl named Charlotte Fiji, and Charlotte has a congenital abnormality called Dravet syndrome, and what that does is it results in her having several hundred seizures a week. And I don't know if anyone has a family or a friend that has epilepsy, but when you have a seizure, that's just the beginning of it. Once the seizure is gone, you often will spend hours, perhaps even the rest of the day, in what we call a post-ictal state, which is a very somnolent, kind of confused and lethargic state. But long story short, Charlotte's mother, in her wisdom, and they were having limited results with traditional medical treatment for this, took Charlotte up, moved to Colorado, where CBD and hemp and marijuana was available. They hooked up with the Stanley brothers, who are breeders and growers of cannabis out in Colorado, and they came up with a variety of cannabis that they named Charlotte's Web after Charlotte Fiji. And Charlotte had tremendous results from this, to the point where she, socializing, bonding with her parents better, able to learn language better, and just generally has a better quality of life. And when this hit the news, it was very moving, right? A lot of people's like, oh my gosh, there's this little girl, she couldn't be treated with anything else. Here's this product, part of the marijuana plant. She's had tremendous benefit for it. So she kind of became the poster child, if you will, for cannabis and CBD in the early days. There's never been a medical study that supports the idea of cannabis as a gateway drug. Okay, there's never been a major medical organization that agreed that cannabis should be Schedule 1, which it is on the Federal Register. Schedule 1 drugs federally means zero benefit, high abuse potential. So all of this has been largely centered around politics. There was a guy named Henry Anslinger back in the 1930s who was in charge of what was now the Drug Enforcement Agency. Right. And he was very tight with the Hearst and the paper barons of the time, and essentially demonized cannabis, again, claiming that it made people criminally insane for the benefit of their cohorts, right? It had nothing to do with the actual medication itself. Enough of that politics for a moment. So how does CBD work? CBD and the other cannabinoids work in the body through the system in the body called the endocannabinoid system. Okay, it's a natural system that we all have. Now, the endocannabinoid system is designed to help maintain balance in the body. Where these cannabinoids work, THC actually mimics a chemical in the body called anandamide. Ananda is Sanskrit for bliss. Anandamide is a chemical that works in the synapses, and when the level of activity, where nerves communicate, right? When the level of activity gets too high, it brings it down, and when it gets too low, it brings it up. So again, its role is to create balance. Cannabis is effective for a lot of the most common problems that people deal with in our society. Pain, inflammation, anxiety, sleeplessness. In fact, all of the things that people rave about with cannabis on the medical side, regardless of why they came in for it, better sleep is far and away probably the most important thing to them. We see one of the favorite aspects of medical cannabis. The second most favorable aspect is reduced anxiety or improved mood, right? A lot of people are able to get off their anxiety medications, their antidepressants, their sleeping medications, their muscle spasm medications. And I'll just throw this in as an aside of my personal preference. They don't need to reschedule cannabis, because if they do, they'll make it a Schedule 2 or a 3, which will still make it fall as a controlled substance that can be very hard to access. It needs to be descheduled or unscheduled, kind of like alcohol is, right? In the sense that it can be accessed by anyone within limits, of course, of age and so forth. Who can benefit from CBD? I get this question all the time. Can my grandmother use CBD? Can my kids can I use it on my children? Pets, things of that sort. The reality is, if you got fur on your body, CBD can benefit you, right? I don't care if you're a dog or a cat or a person or a squirrel. CBD, we all have endocannabinoid systems. One of the main things that people like about CBD, and I'll focus on CBD for a moment, is the anti-anxiety property. And it's not going to clobber you over the head like a narcotic or a Valium or something like that. But it has a palpable, real effect on anxiety and mood. The other is inflammation. It's a potent anti-inflammatory. So people that use CBD, for example, my mother uses it at night. She swears that it makes her less stiff in the mornings, right? With CBD, I'll get into this more later on, but you start at a relatively low dose. Stay on that dose for about a week, say 10 milligrams a day. It accumulates over the course of a week in your body, and you'll reach the maximum effect if you take it daily like a vitamin for about a week. If after that week you feel like you had some benefit, but you'd like to see what more does, you can always go up. You're not going to overdose and harm yourself with CBD, but you can break the bank, right? It's still expensive. I want to get a little bit into who can't use CBD, because I get that question a lot. And the reality is any contraindication to CBD is actually what we call a relative contraindication. There's no absolute contraindication to using CBD. There's very few people that won't tolerate it. I've never heard of a CBD allergy, for example. The theory, CBD and the other cannabinoids are metabolized in your body by the liver. There's an enzyme in the liver called CP450 or cytochrome P450, which is responsible for breaking down CBD and THC and so forth. That chemical is also responsible for breaking down a lot of other medications, including blood thinners and things like that. So in theory, if your liver wasn't working very well, if you had cirrhosis, advanced liver disease or something like that, putting another chemical in your body that puts a demand on the liver can actually reduce its effectiveness at eliminating other drugs, right? So long story short, the theory is that you take too much of a cannabinoid, you got liver failure, and you're on blood thinners, the level of the blood thinner goes up, it increases your risk of bleeding, and that could be fatal, right? I can tell you that in our practice, and we have thousands of patients, many of whom are extremely ill, I have never had someone that had to quit cannabis or even adjust the doses of their medication because of a medication interaction. How to use CBD. I mentioned a little bit briefly about using it daily. THC is more of an as-needed sort of medication. For some people, it's a regular scheduled medication, but for CBD, it certainly should be taken regularly, more like a vitamin. Eating CBD, one of the major limitations of CBD when you take it internally is it's not absorbed very well. When you take a capsule, for example, only 5 to 15% of the CBD that you take is actually absorbed. The rest just passes on through. Okay. You get the most absorption by inhaling it, but that's true of most things. Topical forms of CBD. In my experience, they work best for people that have small joint pain, hands, wrists, elbows, knees, feet, things like that. Certainly very good for skin conditions. If you've ever had a burn and you put a cannabis cream on that, you'll realize almost immediately that the pain goes away and it doesn't blister. It has a very remarkable effect on skin irritation and burns and things like that. Where do you get CBD? This is maybe the most pertinent question that I answer today. They did a study, a survey, and this was several months ago, and they found that 60% of the CBD products on the market did not have in them what they claimed to. Okay, 60%. They did a follow-up study, and then it was 70%. Okay, and I will attribute that to the fact, that we're in this big bubble, right? CBD, everybody's talking about CBD, and anytime everybody's talking about something, there's going to be a group of people out there that's going to try to take advantage of that financially. So there's a lot of amateurs, and a lot of people with questionable motivation that have gotten into this market. And the main downside of that, apart from the fact that it may have something that's harmful in it, is that if someone decides, hey, I think I should try CBD and see if it works, they get one of these products, they try it, nothing happens. And they assume that CBD didn't help, but it may not have had any CBD at all in it. And what they've done is they've lost the chance to benefit from something, right? They assume that it doesn't work, so they don't use it. They've lost it, and they've never really tried it. They lost the chance to try something very safe and effective. So be very careful about where you get it. Where would I get, how do you decide where to buy it? Buy it from someone that has skin in the game. Somebody that has a reputation to protect, a business to protect, that has enough, that knows that the standard for the industry is having third-party testing of your product and having that available for your patients and customers. So I was already interested, very interested in it. And Annette and I had come to a new phase of our lives where, again, I was finishing up some contract work with the VA. Annette was the transplant coordinator at the University of Virginia. And we were both looking to do something less confined by the medical system. I love what I did. I hated the system. The system was a pain in the butt, right? So we were both looking to do something new and different. We moved. Annette was born and raised in the Kalamazoo area, and we came back to Kalamazoo. Her parents are aging, things like that. And it's like, and originally I went to see a fellow named John Targowski, who is an attorney and one of the fellows that wrote a lot of the laws, Michigan laws surrounding cannabis. I didn't know it at the time. I'm like, yeah, I'm really interested. I know that the medical marijuana program had just started here. I just want to know more about it because I'm interested in it. So I went in there and I plopped down $100 to retain him. And in the end of it, he's like, so you're a doctor? I'm like, yeah. He's like, and you believe in cannabis? I'm like, yeah. It's like, we need you. Right. And we were one of the first, really, on the western side of the state to even do this. I had the advantage, of course, because it was more controversial in the beginning, right? A lot of the docs wouldn't touch it with a 10-foot pole because they were worried about their reputations or legalities or how it would impact their practice, or their partners weren't on board with it or whatever. I had the advantage of not being from here, so I wasn't worried about my reputation. Right? And no, I didn't have anybody saying, oh, shame on you, right? So that was a big part. I think it was, in a way, good that I came from the outside, from another state, when I came here in the beginning to do this. But I got interested because of my patients, and my interest was fueled by the support I got from the community, basically. And they still, I feel like I've been lifted up and carried in a way. When I took this, when you take on a project where you only serve yourself, you're the only person working on it, right? But when you get into a project that helps the people around you, everybody, and that's part of a bigger movement, you have the energy of everybody that's involved in it. And I refuse, I'll just tell you, that's what has brought us forward and made us stay involved in this, is the tremendous support that we've gotten based on what we've done. But I got into it because I was interested. And I wasn't, I didn't have a lot of the taboo wasn't there for me.
No.
Yeah.